wash my hands and introduce myself. My name is Frances. I'm going to be your RN today. Can you verify your name and date of birth? And then I can check the patient's wristband. Today we're going, do you have any allergies that we need to be aware of today? Okay, do you know if you're allergic to betadine? Okay, no, that's good. So today you have an order from your doctor to put in an IV. It shouldn't take that long. It'll take like 5 to 10 minutes. I'm gonna go get the supplies and I'll be right back. I'm back with the supplies. Can you verify your name and date of birth? Okay, before we start, do you have any questions that I can answer before this procedure starts? Okay, so I'm gonna wash my hands. I'm gonna put on my gloves. And then I'm just gonna set everything up so I'll be ready whenever I do find a vein. I'm going to get this out. Set that up. Open everything away from me to maintain sterility. Okay. So first we have to flush the catheter to make sure there's no air or bubbles going into the patient. So we'll just attach this normal saline and just flush it. Okay. And then we'll leave that in here to keep sterility. Here we have the needle, so we're going to tourniquet the patient now. Okay. So then we're going to wipe down the area, make sure it's clean before we go in with the needle. So we wipe in to out to prevent contamination. Okay, and then discard that. So we're going to be using a 22 gauge. If we were going in with more viscous liquid or taking out more thick liquid, we would go in with a smaller gauge, just in case. So I'm going to open this. Then I'm going to go in bevel up. I see a vein that is engorged, so I'm going to go at a 45-degree angle. Okay, I see flash, so I'm going to advance it and then hold it. Put this in the sharps. Then I'm going to get my saline and lock it. And then I'm going to flush. And if they feel coolness, that means it is in the vein. Okay. So after that, it's going to be flushed, and then we're going to take this out. Advance it a little bit more. We need to release the tourniquet so the blood flow will stop spewing everywhere. And we're going to lock this. Okay. So we're going to go in our kit and wipe everything down. And then the saline we can just trash because we don't need that. So now we just need to tape down the catheter to make sure it doesn't go anywhere or gets possibly ripped out or anything like that. So we're going to leave that there. Trash this. Get the tape. Don't want to. Right here. And then we can go under the catheter. And be sure not to cover up the incision site so you can see later if it's irritated or anything like that. Then we can get our other piece. Tape it down also so it doesn't go anywhere. Then for this piece we can use the Tegaderm. And with the Tegaderm, it just allows us to see what's going on, keeping it clean. Okay. And there's a thing on the Tegaderm where we can put our name, the gauge, and today's date for future nurses, so they know what we did. Okay, so we would take this sticker off, and there we go. Put it on here and put our name and date, and then I'm going to tape down this part. Tape down this part so it doesn't go anywhere. Okay, so we're done putting in your IV. Do you have any questions or concerns? Okay, so let me know if I can get you anything else. I'm just going to be cleaning up. Ring if you need me, or I'll be back in a couple hours to check on you. So it's been a couple days and it looks like you're doing much better, and we have an order to get the IV taken out. So I'm going to wash my hands. I'm gonna wash my hands, put on new gloves, and remove your IV. Do you have any questions? Okay, good. Can you verify your name and date of birth for me? Okay. Do you have any allergies, new allergies that we need to be aware of today? Still not allergic to betadine? Okay. So we're going to be removing your IV. We're just going to be taking these stick tapes off. Let me know if it's hurting you and I'll stop. Okay, so that's trash. I'm trying to be careful not to hurt them. So with the Tegaderm, you just pull away and it comes with it. And then on the count of 3, I'm going to remove it and hold pressure. Pressure with this in case bleeding. 1, 2, 3. Okay. So we discard this and then give them a Band-Aid if needed, but he's doing fine. So do you have any other questions or concerns? Okay. I'll be in here in a couple hours to check on you.